Today we discuss about very important clinical condition or disease, epilepsy, mirgi. In simple words, it is called mirgi, epilepsy. What is epilepsy? Epilepsy is transient, paroxysmal disturbance of the central nervous system, which is characterized by uncontrolled excessive neuronal discharge from the brain. Right? So this epilepsy is transient, paroxysmal and repetitive disturbance of the central nervous system in which there is uncontrolled excessive neuronal discharge from the brain. It is accompanied by partial or complete loss of consciousness. So accompanied by partial or complete loss of consciousness. It may be accompanied by uncontrolled motor reaction. May be accompanied by uncontrolled motor reaction. We can divide epilepsy into two types: generalized and second type is focal or localized. Focal or localized. Now, as the name indicates, in generalized epilepsy, uncontrolled excessive neuronal discharge is from whole of the brain. In generalized type, the excessive uncontrolled discharge from neurons is from whole of the brain. In focal type, in localized type, this uncontrolled excessive discharge is from neurons in a part of the brain. Localized, focal. Now first about the generalized type of epilepsy. In generalized type, there are two types of epilepsy: grand mal and petit mal. Petit mal. So these are the two types of generalized epilepsy: grand mal or petit mal. So first we discuss about grand mal epilepsy. It is also called generalized tonic-clonic seizures. Generalized tonic-clonic seizures. So grand mal epilepsy is also called generalized tonic-clonic seizures. Some of you might have seen the cases of epilepsy, right? Of grand mal epilepsy or generalized tonic-clonic seizures. Now in this seizure or epileptic fit, what happens and what are the stages? Now before the epileptic fit, epileptic seizure, there is warning which is called aura. Warning or aura. In this warning aura, there are hallucinations. There are hallucinations. What is hallucination? Feeling of something which is not actually there. So the patient feels something which is not actually there. Hallucinations. So different types of hallucinations: tactile, visual, auditory, olfactory, gustatory. So these are different types of hallucinations which the patient can feel. Patient feels something moving on the body. Tactile hallucination which is not there. Person may hear some noise, something which is not there. Person may taste something which is not there. Person may smell something which is not there. Right? So these are different types of hallucinations which the person can feel, can perceive, and this is the aura. So just before the epileptic fit, there may be epileptic cry. So epileptic cry just before the fit. So there are two phases of the grandmother epileptic fit, two phases of the epileptic fit or seizure. Tonic phase, clonic phase, and of course it is the post-ictal stupor or coma. So these are the two phases of the generalized tonic-clonic seizure or grand mal epilepsy. So just before the epileptic seizure, there is aura warning. In this aura there are hallucinations. It may be tactile, visual, auditory, olfactory, gustatory, right? And then the patient falls, becomes unconscious, and in the tonic phase, there is tonic contraction of the body muscles. Tonic contractions of the body muscles. You can see legs are extended, back is extended, while the arms are flexed. Arms are flexed. So tonic contraction of the muscles of the body, legs, arms, back, right? So legs are extended, back is hyperextended or extended, arms are flexed, right? So this tonic phase, it remains for seconds. It remains for some seconds, and then comes the clonic phase. In the clonic phase, there are strong, jerky contractions of the muscles. Strong, jerky contractions of the muscles. There is strong, jerky contraction of the muscles of the legs, arms, facial muscles, muscles of the mastication, right? There may be eyes blinking, right? So this is the clonic phase, strong, jerky contraction of muscles of the legs, other muscles of the body. Now in this phase, there may be difficulty in breathing, obstruction to the breathing. So there may be cyanosis in the patient in this stage. Due to strong jerky contraction muscles of the face and the mastication, there may be tongue biting. Tongue biting is there. Then there may be urination or defecation in this phase. Maybe urination or defecation in this phase. Now this clonic phase, it remains for say 3 to 4 minutes. It remains for 3 to 4 minutes. And then after this clonic phase, the patient remains semi-unconscious or unresponsive for many minutes. Patient remains unresponsive or semi-unconscious for many minutes. You see in the EEG, electroencephalogram, there are high voltage, rapid waves, fast waves. So high voltage, fast waves in this phase, especially clonic phase, and then the rate of the frequency of the waves becomes slow. So this is the fast rapid waves in clonic phase, and there will be high voltage, somewhat slow waves in the clonic phase. So these are the two main phases of the grand mal epileptic fit or generalized tonic-clonic seizure. Right? After the generalized tonic-clonic seizure, the patient remains fatigued for many hours. Patient remains fatigued for many hours after this generalized tonic-clonic seizure. In some cases, epilepsy, grand mal type epilepsy, the epileptic fits occur in succession. In some patients, the epileptic fits occur in succession, and one after the other, and the patient fails to regain consciousness. The patient fails to regain consciousness. This is called status epilepticus. It is called status epilepticus. Status epilepticus. Now we have discussed the generalized tonic-clonic seizure or grand mal seizure. Which factors activate or initiate the seizure? The factors which can initiate the epileptic fit or seizure, these include strong emotional stimuli, stimulant drugs, hyperventilation leading to alkalosis, fever, loud noise, flashing lights. So flashing lights can also activate the epileptic fit. Now keep in mind, in epileptic patients, there is family history of epilepsy. So this fact is very important, that the epilepsy may run in families. So genetic predisposition is important in these cases of epilepsy. Similarly, other factors such as trauma to the brain resulting into scarring of the tissue. So brain trauma resulting into scarring of the tissue. Maybe a tumor, maybe some vascular abnormality in the brain. So these can lead to epilepsy. So when there is an epileptic fit or seizure, how does it come to an end? So there are two possible factors involved in the mechanism by which an epileptic fit comes to an end. The first one is neuronal fatigue or synaptic fatigue. Neuronal fatigue or fatigue of synaptic transmission. Fatigue of synaptic transmission. And the other factor is inhibition of the excessive neuronal activity. Inhibition of the excessive neuronal activity by some center in the brain. We can say active inhibition of the excessive neuronal activity by some center in the brain. So this was about the generalized tonic-clonic seizure or grand mal epilepsy. So the second type of the generalized epilepsy is petit mal. Petit mal epilepsy. Petit mal epilepsy. Petit mal epilepsy is also called absence seizures. Absence seizure. It's also called absence seizure. Absence seizure, right? Now in petit mal epilepsy or absence seizures, there are brief periods of unconsciousness. Brief periods of unconsciousness lasting for say 5 to 30 seconds. So brief periods of unconsciousness lasting for 5 to 30 seconds. 5 to 30 seconds. It is more common in boys. More common in boys. So this boy is reading a book. Suddenly, the boy loses contact with the environment. Suddenly, the boy loses contact with the environment. Stares blankly into the space. Stares blankly into the space. They may be blinking of the eyes, blinking of the eyelids, right? So this is the absence seizure. Absence seizure in this boy who was reading a book, and the boy suddenly loses contact with the environment, stares blankly into the space, right? They may be blinking of the eyes. After some seconds, the boy recovers. After some seconds, the boy recovers. This is the absence seizure or petit mal seizure or epilepsy. Now in the EEG, during the absence seizure, EEG shows spike and dome pattern. You see, spike and then dome, D-O-M-E. Spike and dome pattern or spike and wave pattern. So spike and dome or spike and wave pattern is typical of the petit mal epilepsy or absence seizure. So spike and wave or spike and dome pattern is typical of the absence seizure or the petit mal epilepsy. Now in petit mal epilepsy, there is disorder in the thalamocortical portion of the reticular activating system. Petit mal is due to disorder of the thalamocortical portion of the reticular activating system. Now most of these boys recover when they reach the age of about 30 years. So many of these boys recover when they reach the age of about 30 years. Right? So this was the patent ball epilepsy. Right? Next we come to the focal or localized epilepsy. And first the type in this group is psychomotor epilepsy. Psychomotor epilepsy. Now in psychomotor epilepsy, there is some muscle contraction, say contraction of the lips, or there may be swallowing or deglutition contraction. Along with it, there is a brief period of confusion, or brief period of anxiety, fear, rage, brief period of amnesia. So, some localized muscle contractions, say lips contract, and then movement of the deglutition or swallowing. Along with that, there is a brief period of confusion, fear, anxiety, rage, amnesia. This is the psychomotor epilepsy. Psychomotor epilepsy. Now in psychomotor epilepsy, there is a lesion or disorder in the limbic system. With lesion or disorder in the limbic system, say hypothalamus, amygdala, hippocampus, septum, and temporal cortex. So the disorder, disturbance, or the lesion is in the limbic system, including hypothalamus, amygdala, hippocampus, septum, and temporal cortex. In the EEG, you see, this is the EEG pattern of the psychomotor epilepsy. So in the EEG, high voltage, slow, rectangular waves. Right? So high voltage, slow, rectangular waves are typical of the psychomotor epilepsy. So high voltage, slow, rectangular waves are present in the EEG. So this is about the psychomotor epilepsy. Then the other type of the focal epilepsy. Now in focal epilepsy, excessive neuronal discharge is from some part of the brain or cerebral cortex. Not the whole brain or the whole cerebral cortex. So this excessive neuronal discharge is from a part of the brain or cerebral cortex. And this is called Jacksonian. Jacksonian epilepsy. It may be motor Jacksonian or sensory Jacksonian epilepsy. So first about the motor Jacksonian epilepsy. Motor Jacksonian epilepsy. excessive neuronal discharge is from a part of the brain, a cerebral cortex, and it is from a part of the motor cortex. So excessive neuron discharge is from a part of the motor cortex, a part of the motor cortex. And this results into movement of the toes, foot, or movement of the fingers, hand, or maybe the facial muscles contract. So this is the focal epilepsy, that is the motor Jacksonian epilepsy, in which there is excessive neuronal discharge from a part of the motor cortex, resulting into contraction or movement of the toes, foot, fingers, hand, or face. And this is the motor Jacksonian epilepsy. In sensory Jacksonian epilepsy, there is excessive neuronal discharge from a part of the parietal cortex. So in sensory epilepsy, Jacksonian type, there is excessive neuronal discharge from a part of the parietal cortex. And this results into some sensory perception, say feeling of some noise, feeling of some smell. Person may smell something which is not there. Person may feel something on the part of the body which is not actually there. So this is the sensory Jacksonian epilepsy, in which uncontrolled neuronal discharge is from part of the parietal lobe or some sensory area in the cerebral cortex. So this was about the epilepsy, its types, right? Thank you.